Hi,
Hi.
again.
Hi.
And I'm Liron Meidan, and we are here in Vienna, ESD 2025. And in front of me is Professor Partha S. I'm so honored to meet you
Thank
here.
you for asking.
Yeah, and we saw each other last time in Amsterdam.
Yeah.
And please tell the audience, diabetic people, about you a little bit.
Yeah, so I am a specialist or a consultant in diabetes. I do work in type 1 diabetes, type 2 diabetes, and a bit in obesity as well. But my main work is around what I call is a policy role across England. And that's mostly focused in getting access to the most modern insulins, continuous glucose monitors, insulin pumps. And of course, there are other pieces of work that we do around language matters, stigma, raising awareness. All of those work is there as well.
So fascinating. Stigma, awareness. This is what I'm dealing with, and we are talking about it in my country as well all the time, because it's present. It's here, and we need to talk about it, and maybe awareness will help for these topics. When did you realize that you want to specialize in an endocrinologist, and especially type 1 diabetes? You told me that you're dealing with, help people with type 2 diabetes. When did you know that you want to do it? Because I can see you're passionate about it so much.
Well, I think some of it is because of people you get to know in your life. And in my life, I've had some really good seniors and people who have guided me. There was David Jenkins and Paul Nurick, Alistair Miller. All of these people were diabetes specialists. And one of the things that they taught me, that you could be there as part of the journey and try and help people with your knowledge and skills. So I think that, you know, in your training, you go through different specialties. And when I did diabetes, I really enjoyed it. And I think that's when it started, probably, I would say.
When I saw you on stage back in Stockholm, ESD, and I saw you on stage, and I remember I thought to myself, how does he know what I feel? Maybe he has diabetes too, because how can he know what I've been through? It was so sensitive, not judgmental, and you try to speak with doctors and tell them that we as diabetic don't need judgmental. We need to feel free to speak in front of a doctor and tell what really bothers us. And I felt, it was the first moment that I felt that I came to this conference, and now it begins with you. And do you still still think that judgmental exists in?
Oh, absolutely. I think a lot of doctors and clinicians come from a judgmental place. So that's the work that we tend to do. And one of the things I've learned is that there's no point in being that, because you'll only see them once in a while. So you have to be more understanding of the problems they're going through. And, I don't have diabetes, so I will not know all the experiences. So I think mine has been shaped. We have been very fortunate where I am in the UK of the relationship that's been built with the diabetes community. And I think they're always learning. As you go there, you listen, you understand what the problems are. And I think that's, what you try to do is pass it on to your colleagues and say that that's probably will make them or help them deliver better care if you do it like that.
So you teach doctors, other doctors, how to treat or understand people with diabetes better. Yeah,
I think it's about how you converse. When you say language matters, it's not, sometimes the debate becomes, oh, should we call them diabetic or person with diabetes? That's not the whole point. The whole point is big understanding in your clinic, and understanding that sometimes there are lots of other pressures in life, which is why the diabetes control may not be good, right? There might be other things going on in their lives. So I think just being appreciative of that, I think is important. So yeah, that's part of the teaching that I do with lots of colleagues as well.
You say language is matter, but I can sense that energy matters too, because your energy is not judgmental. And I think as a person with diabetes, I immediately feel that.
And I think that's also part of the training. You need to understand what you are saying, the impact that it leaves, and I think body language and how you converse is very important.
Body language, wow.
And I think, people pick off that. What you're saying and how you are sitting and talking. So those are all very important bits.
And how you stand and talk to people, to the audience, your audience, and that was like amazing for me, healing, even healing for me.
Good.
Yeah. And this is very emotional for me, but in my first years with diabetes, I was stubborn. You know me a little bit. I refused to inject insulin and put on CGM. What do you think, from your point of view, is good for to do with people as stubborn as me, to push them more, or maybe?
I think everybody needs time and space. I think that's important. I think everybody comes from every individual is very different.
Yeah. But you lose the first or second year of I can understand now that it matters, the first and the second year.
I think so. I think you also need to remember, for lots of people, it's a bit like grief. So you have to understand that, the 6 stages of grief, that's well recognized. So you have to, sometimes people, that depends on their personality. Sometimes people go like, it's fine, I'll get on with it. Some people take longer. So I think you just need to appreciate that, and sometimes you just need to work with them until they're ready. So you tell them the importance, you tell them what you're trying to do, and it just takes time sometimes, and that's okay. So
some doctors think that you need to force people to connect. This is the best way, I know the best, and we will just push you until you connect. I'm not sure what I think about it, because I grieved for at least 2 years. But nobody pushed me.
I think, what happens, people call it tough love, we're pushing, we're doing it from a right space. That's what lots of people will say. I'm not quite sure there is evidence that actually helps. I think it might push the person further away, right? So I think there's a balance there, because you need to explain the problems, the risks, and what you're trying to do better. I think it's more about conversations. I personally don't believe in pushing people. I think you have to, people are adults, you have to lay it down, you try and find other ways to talk to them. I think that's the way to do it.
I think it's the only disease that you need, the doctors need to convince patients to treat, because most people, if they have pain, they go and want to get help from medical teams. But in diabetes, it's like you, as a doctor, and sometimes I put myself in this position, and I can see you're struggling to convince people to treat themselves.
Absolutely, 100%. I think that's the balance. So I don't think pushing anybody, in my book, doesn't work. That's my philosophy in life. So, and that's how I do my clinics.
Wow. So you're a lot on social media, and I see your posts every day, even a few times a day. And I think that in our world, this is so important for doctors and specialists like you. Touch the audience, touch people that are dealing now. And this is not very common, and you do it all the time. And every social media exists. So this is, you're like Paul McCartney of diabetes, we all admire you and appreciate it, because you talk to us, straight to us, in not judgmental way, and very immediate,
open way,
immediately, and we see you all the time and see what you think, and this is amazing. And do you think it's important for doctors? And
I think every personality will be different. I think it's a good tool. I mean, let's not forget, social media can also be quite toxic, as we know in the present world. So I think people need to learn how to use social media. That's important. I think social media can be a good platform to learn. I think social media can be a very good platform, as you say, to interact with those you look after. I think you can use it to cascade good information, like diagnosing type 1 diabetes on time, and what are the most modern technology, etc. All of that. So I think it can be that. So it's important to be aware of the power of social media in the present world. So, and social media is not just Twitter, right? It's also Instagram, it's also Facebook, it's also LinkedIn. They're all social media. So you might find a platform which suits you better, but I would use it. That would be my encouragement to clinicians, because it helps you connect with people better. I think in my example, I think it makes me a better clinician that way as well.
And have you learned something from social media that doctors can't learn from their
the lived experience? You listen to people, you see what they're going through, you look at the videos, the posts, the struggles, and you have an understanding that universities or colleges or books will not teach you. So I think that's what is important part of social media.
To feel and
absolutely
feel people.
Yeah.
And do you think nurses, dietitians need to, because it helps to fight the disinformation on social media about health, about
very important, because people will say that, oh, you can cure type 1 diabetes by doing this, or they will say type 2 diabetes is very simple and all you need to do is eat less. None of them are true. So I think you have to fight those disinformation, and also you can also help fight the stigma that's attached with it. So there's a lot of work that you can do with social media. It gives you I would say a reach which not many places can give. So for example, we're at ESD. If you think of the reach people have, they do their talk, they talk about their science. They'll talk to how many? 1,000 people if the hall is really, really busy. I mean, that's rare, but that's only 1,000 people. But if you have social media, you've got a reach of 10,000 people. So I think it's about knowing about the reach you can get to. So that's also important.
Yeah, you can reach so many people all at once, so quickly.
Yeah. And these conferences don't have many people living with diabetes here.
Yeah.
So, thereby, but in social media, you can reach out and you can discuss your paper and see what they feel. All of that is important.
Yeah, I saw that people think, stigmatized people that use insulin. So insulin is not sexy. And when I figured it out, and people just want not to take drugs, not to take insulin.
Correct.
I just made a video about people that say that all they want is not take their drugs, not to inject insulin, because it looks like they're sick. And it's much more important. Yeah, it's much more important for them not to take their medicine than be balanced. So maybe we set up goals that are not. This is not. Which
is not possible to reach for lots of people. So you need to absolutely set standards or set goals which are feasible and give them more hope.
I told my followers, listen, we need to be balanced, not to not take drugs. So we just confused with our goals. So this is my way to maybe educate, maybe tell them, I inject insulin. Look, I'm injecting insulin. Look at my point of view. Insulin is not that bad. I understand that you think this is for all people, the dead people. I don't know. This is the stigma about insulin. Not even diabetes or obesity.
No, it's well recognized in many countries about the stigma with insulin. So again, it's about education. It's about passing on. It's about sharing what you are doing, and I think that inspires people. So yeah.
Yeah, and then I told them, you know. In our country, you can get insulin whenever you want with your health insurance, but other countries
they can't get it. Yeah,
they can't get it. They can't buy it. And just open your mind and understand you are lucky that you have it here. So when I figure out that when you open them to see what's going on in the world about it, maybe you feel less ashamed, less
under pressure, less stigma, all of that.
Less stigma, less maybe oh my God, what's going on with me now? I have diabetes. Okay, you have a solution. You are lucky that you have this solution. So this is my fight to show people what's going on, what's really going on, and our point of view, that I can keep smiling and I live my life and I inject insulin. Yeah, so it's not that awful.
Absolutely.
So I really appreciate your your posts, and this is amazing in my eyes that someone like you in your position do that, because this is so important. I see your podcast and I listen to you a lot, and I can see clearly that you don't mind to say what you think, and you have criticism, and you say openly about failures. You're talking about failures, and the first time that I saw you talk about it, I was like amazed by that, because in my eyes, to talk about your failures, or to feel free to criticize place that you work in, or I don't know, like you did, it make it more reliable, and I feel that I can connect to you, because you talk about your failures. This is like so human, and also it needed a lot of confidence to do that. What do people say about it? Other people think like me, or maybe they.
I think it comes with, I suppose, being more comfortable in your own self. It doesn't come immediately. I think I've been blessed with lots of success, so I think it makes it more easier to speak about failures. And I think it's also to show to everybody that life isn't just about winning everything. Sometimes you will fail, and that's fine. And then you learn from that, and you try different things. So, policy role, I would have tried different things, not work, but there are lots of things which have worked. So I think that's important for people to realize, is that when you're seeing somebody who's a public figure, not everything is a success. And I think that's an important message.
That important, that this is so inspiring for me, because when you do that, and you still go on stages, talk to people, lecture, feel that confident, and still talk about your failures, this is like mind-blowing for me, because you always want to say that you are the best. People want to, everybody will love them, and say things that they have done, and to see you do that. This is not all about diabetes. This is about leadership, I believe.
Good, thank you.
Yeah, you speak a lot about leadership, right?
Yeah, I think leadership comes in different forms. So, leadership isn't just about somebody being in front and leading everything. Leadership, you can be a leader of any team, if that makes sense. And everybody comes with different skill sets as to how you do it. But to me, leadership is also very important to be open about your, what I call, accountability. So if you've got certain things to do, have you achieved that? That's important in leadership. So, and that's the philosophy followed in life and sports everywhere. If you're leading a team, has your team won things, or have they tried hard? So I think similarly if you're an academic, your leadership is what? Producing papers that gets into lives. That's leadership. So I think leadership is incredibly important, and the thing is, everybody can do their little bit. So I talk about leadership a lot, because leadership isn't easy, because I think you have to be ready to face criticism. That's important that you take that. So yeah, that's what leadership is about.
How do you deal with the criticism?
It's part and parcel of the job. I think if you are stepping forward to do a leadership role, you will have to accept that there will be people who don't like what you do. They may not like your style of doing things. They may not like the way you present yourself. They may not like a lot of things, or they just may not like what you've achieved. So there's also things like professional jealousy. All of those things are there. So I think you need to sort of accept that a leadership role will have those, and that's fine. You're walking into it with that in the back. So you need to have good friends, family, good support structure around you all the time. So when you take breaks from all these things, you have nice breaks, and you can refresh and come back. Amazing.
I think think about leadership also, because when I identify that people are so ashamed that they can't speak, and I understand that when I felt alone, maybe other people feel alone too, and
of course.
And maybe I can give them
help them some hope.
Example for that, and this is, in my eyes, this is also leadership, because I wanted it. I wanted someone to look up to when I was struggling.
Sure.
So, what do we hope that people back at home will learn from our conversation? What our main message to them?
I think, so if you're a clinician, I would say, and you're listening to this, I would say, take a moment to always understand that you're not living the life of the person in front. You don't have diabetes, so you need to be more understanding and empathetic to the pressures that living with diabetes brings, whether it's type 1, type 2. And I think if you have somebody, for example, who's got type 1 diabetes who looks at it, I would say, you have got plenty of help and support around, like some of the work that you are doing. Listen to these, see what you can learn from. So the world is very different nowadays compared to what it was 10, 15 years ago. There's modern technology, there's insulin. If they're available to you, think about what you can do to help your life be better. Those days when you had diabetes, thereby you will have complications, are gone. So if you've got the right support and the right tools, the right technology, you can prevent yourself from getting those, so which is good news.
Yeah, and families, like I can see a lot of parents that are taking diabetes from their child to themselves, and they don't let go. They think that it's theirs.
That's the love of parents, isn't it? So I think that's
important.
Yeah,
but it's like a bear hug.
Absolutely.
because you need him or
to
her
also
to
develop and do their own life. Absolutely.
To take responsibility over this, and I deal with it all the time with these conversations, because I can see that they are speaking like they are having type 1 diabetes, but you are not. No. And with all the respect, it's a very common conversations, because they want to take the pain from their child.
Of course.
Yeah, they have something to say to them, and I will show them. You were saying that.
I think as parents, I fully understand where parents come from. Yeah. The love for your child is an overriding thing, but I think you also need to realize that you will not be there for them all the time. So at some point, you'll have to give them the wings to fly. So you need to support them at a certain stage. I always say you need to think of the age and maturity, and then try and help them develop their own life, their own injections, their own living with diabetes. It's very important, because at one point, if your support structure then goes and they haven't developed, they will just collapse. So I think it's important you phase them into being able to let them fly.
Yeah, let go a little bit, as much as you can for them.
Absolutely.
And maybe you can tell me what you think about dietitian. Okay, it's a very delicate topic, because in my country we struggle with that. Not many people wants to go to dietitians, and there's a reason, because nobody wants other people to say, okay, now you can't eat this, and you can't.
So in my experience, dietitians are a fundamental part of diabetes care. I think dietitians also need to be non-judgmental when they're giving advice. I think that's important. So rather than saying, if somebody comes along and says, these are the food I have, rather than giving them a lecture about what they shouldn't have, probably try and work with them. I think a lot of people don't end up going to dietitians or any clinicians because they feel they'll be given a lecture. And I think everybody needs to learn from that. So I think, in my experience, they're a very fundamental part of diabetes teams because of what they can offer with your insulin dosing, the type of food you're having, how much protein's in the food, how much carbs are in the food, what time the glucose will release in the system. They've got a very good knowledge of all of those. So they can help you with the timing of the insulin, the dose of the insulin. So yeah, I think it's a joint partnership.
So it's the way, so you say that they are so professional, but the way that they need to deliver their message needs to be changed, or
Absolutely.
needs to be...
Just like, as I said about doctors, the same thing.
Yeah.
You know, professionals as a group, I don't think I would say just dietitians, everybody. I think needs to deliver their care differently so that people come back to them. So yeah, it's the same thing. Don't be judgmental about anything, whether it's their insulin dose or the food you take. So you just need to be less judgmental.
I remember that I consulted a dietitian. I was so angry about my situation. She was gentle, she was nice, and she told me what I need to inject now before I eat, and this situation. I still try to understand how much it was my experience, and how much she can help me in this situation, because nobody wants to inject and feel pain before he enjoy from food. So I still wondering about it, because where there is a responsibility also for us as a community, or me as a diabetic, for taking responsibility of what happened to me. And I need to go to nutrition now to understand what I need to do. She, of course, need to tell me what I can do, because I felt it's so needed. I felt that I can't do nothing now. I can't eat nothing now. Yeah. And I think that this is what we can do. And this is the reason I upload all the time on social media what I eat, and not what I can't eat. So
and it's all about that learning, isn't it? I think
learning, and take decisions. This is the reason I come to these conferences all the time, because I want to learn all the time and make decisions not out of emotions.
Absolutely,
out of
true.
knowledge.
Very true.
Yeah. How do you see management of diabetes 10 years from now? How it looks like? What is the doctor's position in this all technology? And
I think type 1 diabetes will move more towards technology. I think more and more it will become, I think the fully closed loop will come next. I think that will be important. I think some of the exciting trials that are going on with Vertex and Sana, I would be very interested to see what immunotherapy does, about the stem cell work. So I think there's some really exciting stuff in the type 1 world. I think in the type 2 world, the glucagon-like peptides are going to keep on increasing. There are different combinations coming, and I think they're going to become the main drug in that world. So I think those are the two things that will happen. I think that will go down that route of the very potent drugs that you're now seeing with Mounjaro and everything else. And type 1 will become more and more automated. That's what will happen.
Wow. This is exciting years now.
Yeah, absolutely. Next 5-10 years, quite exciting.
Yeah. And do you have one tip for a doctor that treats people with diabetes, maybe type 2, type 1, whatever one tip for doctors?
Listen more. I think that's the first tip I would give. Listen, take more time to listen in clinic. I think if you listen and let the other person, or the person with diabetes, speak, you will probably pick up more clues, and you can probably help them more. That would be my one tip.
Amazing. Do you have one question? I give you one to ask me that you maybe can't ask your patients as a diabetic. And
I suppose, how is it, I think the question I would have is probably more cultural rather than related to the diabetes, that in your world where you live, how does type 1 diabetes care? Do you feel that type 1 diabetes care can be better? That's probably the question I would have. Do you think it is comparable to some of the best in the world?
Very good question. I think that we have a very good health insurance. I think that it's always like this, that you have the options, and then our decisions
are different.
Are different.
But the system is quite good.
Yeah, because when we go to these conferences, I'm with a group of people with diabetes, and I met some people from other countries that I heard them saying that they wish they have
everything that you have. Yeah.
Everything that we have. And I told them back, I told her, she was from Guatemala, and I told her, you know what? in my country, we have this device and people don't want to get it. And she was amazed.
Very different world.
She told me, oh my God, she showed me pictures with insulin inside of a fridge, which is locked, and everybody looked at this fridge and keep it like it's gold. And I told her, people in my country, they don't.
Not a problem. Yeah.
They don't mind about it. They don't understand the value. And then I understand what is my position in this in my community. What is my position? Because it's not only type 1 diabetes, it's also type 2 diabetes. They don't mind about it. They don't care about insulin. They don't think this is gold. And then I started posting more posts about, listen, I inject insulin and I'm happy and everything is fine, and I can represent or be a presenter for insulin, because there is presenter for clothes and presenter for glasses and for purse and insulin too. And I think this, and when they see me smiling most of the time, so I still struggle. I don't paint diabetes with pink, but I say what I feel. I don't hide it.
Good.
And but I still say that I'm taking responsibility, and I understand, and I'm learning all the time, and I consulted people like you that are specialized in this field, and I want to listen to researchers and
good.
Yeah, it's very special for me to be in front of you.
It's a pleasure, absolute pleasure.
Yeah.
Thank you.
Thank you, and I think we are going back to the conference.
Okay. Yes.
And
I look forward to it.
Yeah. Thank you so much.
Absolute pleasure. Thank you.